I feel that I have to remind the House that we have had 95 hours of debate in recent years on this topic, and the implication that we haven't debated this, I think, is a misrepresentation of the many hours of debate that we've had. The Noble Lord Forsyth has asked us to not talk about assisted dying, but then actually did talk about some aspects. We're being asked to test the willingness in both houses, but I would remind the House that the Maris Bill started in the Commons and was debated there and was defeated there by 330 votes to 118. That is where a bill like this should start. It is true that historically there have been major changes. They have been bills that have started in the House of Commons, and the public understood what they were about. The public knew what capital punishment was, and they know what homosexuality is, and these bills started in the elected House, and they then came to this chamber. That has been our procedure. I would, though, like to challenge the claim that there is overwhelming support amongst the public. I think it's questionable, because actually in a poll when asked a bit more detail, 57% of the public didn't understand what assisted dying is. 42% think it's your right to stop treatment, which is already a legal right, and 10% think it's hospice care. Dignity in Dying have said they want to have the largest record of public support yet to date. They've got less than 0.5% of the population of England and Wales signed up to this list. So I do think we have to look at some of the claims that are being made and think about them. Whatever you think about assisted suicide and euthanasia, this amendment would set a dangerous constitutional precedent for any government. It's surprising that the Noble Lord Forsyth, with his deep respect for parliamentary processes and for governments to be able to govern, has taken this approach, because his amendment would set a precedent enabling any backbencher from any pressure group to disrupt a government's agenda. Does the Noble Lord plan to bring judicial proceedings if his proposal is not tabled in a year? Because that is a criteria in the text of his amendment. A draft bill leads to a bill, assuming and forcing government support, before exploring the evidence of the complexities of licensing doctors to provide lethal drugs. We do indeed already have a bill before us, and it is awaiting debate. The amendments laid are not vexatious. Based on the extensive evidence from abroad, they expose the problems with the noble lady Baroness Meach's proposals. Where assisted dying is legal, palliative care has dwindled, legislation has widened, the safeguards have been seen to fail, and non-assisted violent suicide rates rise disproportionately. Post-event reporting, as in her bill, does not work because it relies on the clinician. I could go on, I won't. Yet, surprisingly, no request was made for committee stage until months after second reading, and no one seems to have sought to discuss the amendments that are being widely criticised by those who've spoken today. Some members want the open prognosis to be dropped from a bill to make legal drugs available on request. We have to at least know what the content of a bill is even before we proceed. An 18-year-old with severe anorexia is already eligible under the bill that's currently laid before us. The answer to harrowing accounts of inadequate care isn't to force the government to draft a bill that would allow doctors to supply massive overdoses of unevaluated lethal drugs to patients. Good holistic palliative care has been made a right in this bill by this government, and people should ask for it and insist on it. This amendment is not the way to seek a careful analysis of the complexities of assisted suicide and euthanasia. It creates a constitutional headache for any future government's ability to govern. The procedure is to debate a private member's bill properly at committee stage, and that private member's bill should start in the elected House.